Hello, my name is Gary Hockman. I'm your facilitator for today, and I'd like to welcome you to this community session regarding the Board of Supervisors' 5-year strategic plan. This session is meant to provide a forum for your input and suggestions about the plan. The Board of Supervisors and Sonoma County leaders are making an extensive effort to gain perspectives from the community in order to enrich the plan and ensure all voices are heard before the plan is finalized. We will be repeating this session tonight at 6 p.m. in Spanish. So you're welcome also to join that session. And certainly if you're a Spanish speaker, that would be the session to tune into. Joining me on this session will be Kelly Knoll. Kelly is the Program Development Manager in the Human Services Department of Sonoma County, and she'll be an important resource as we go through this part of the plan. We also have Catherine DePasqua and Jennifer LaRoque with us too, helping to support the process and catching your input and questions as we go through this hour together. We look forward to hearing your thoughts, questions, ideas, and concerns during the session. There's several ways you will be able to participate during today's session. First of all, we'll use the polling feature in Zoom to ask you to prioritize objectives listed in each goal area. And we'll be covering 4 goal areas. So as we go through each goal at the end, we'll ask you to take a quick poll. And the poll is to get a sense of what does the community care about in terms of prioritization and importance. We'll also give you a chance to make suggestions or ask questions using the Q&A feature of Zoom. You may enter questions using that Q&A icon you see here. If you see a comment in the Q&A that you like, click on the thumbs up icon, so we can see how many people also like that idea. We're also monitoring Facebook Live, so if you're watching that way, feel free to submit questions there as well. For those of you on the phone, please email your thoughts to us at strategicplanning@sonoma-county.org. So that's strategicplanning@sonoma-county.org. And we'll receive those questions and be able to respond to those as well. And then finally, you can also contact us later through that email if you wish. So if you want to send us thoughts after the session, feel free to do that via strategicplanning@sonoma-county.org. We welcome all comments as long as they're constructive. The purpose of this session is to get your inputs, to refine and edit the strategic plan before it's finalized. We do expect to get a lot of comments and questions. We've already received some, so we may not be able to get to all of your input. However, everything will be submitted. Everything that's coming in on our stream will be submitted and forwarded to the steering team that's responsible for harvesting and reviewing these inputs, as well as forwarding them to the Board of Directors or Board of Supervisors. So the board will see all your inputs as well. There's also a survey that's open now through December 4th. So there's another way as well. And the link is on this page. So if you choose to go on to the Survey Monkey, it's one more option as a way to get your input into the process. Since late 2019, the county leaders and board members have been engaged in developing the base framework for this plan. Let's look at how the plan is structured. So the plan has 5 pillars: healthy and safe communities, which will be discussed today, racial equity and social justice, organizational excellence, climate action and resiliency, and resilient infrastructure. It's not intended to reflect all of the county's work, all of the important work that's going on daily, but it is meant to inform policies, resource choices, and prioritizations for the next 5 years. Under each pillar, so the pillars are the key focus areas I just read to you, there are several goals and several objectives. Goals are the outcomes we want to achieve. They're the destination. So below the pillar is the level of the goal. They're based on an important idea or desired future that people can gather around and aim towards. The goals are satisfied through achieving particular objectives. And so the objectives become the measure of the progress needed to achieve the goal. In some cases, they're initiatives. In other cases, they look more like projects. In other cases, they're shaped really more like a metric, if you will. But in any case, if we're successful at achieving those objectives, we're likely to reach our goals. You'll note too on the left-hand side of this slide that several goals and objectives have intersections with other pillars. So there might be parts of today's plan on healthy and safe communities that intersect with racial equity and social justice. And when those intersections are apparent, we've highlighted them with the icons you see on the right side of the page. So if you see an icon next to a particular goal or objective, it refers to another dimension of the plan. So again, we're just looking at 1/5 of the draft of the strategic plan today, just 20%, and that part is the healthy and safe communities. The purpose of community engagement really is to gather the input and reactions on the draft of the plan before it's finalized. So as I mentioned, all the input you provide today will be forwarded to a steering team of county leaders who are responsible for editing and amending and reviewing the plan before it gets presented to the board. The board will also receive your inputs as well as this draft of the plan from the from the steering committee, and be able then to have its own deliberation and determinations before the plan is finalized. What we expect too is that you may have additional goals or objectives for consideration. So you can react to something that's on the page today, but you can also add ideas for us to consider. So please don't hesitate if you have additional goals or objectives to send them our way, and we can put those into consideration. And then finally, the third purpose is really related to the voting I mentioned, that we will give you an opportunity to prioritize what you see on each page. And so the purpose is to understand that relative priority of those various objectives in your eyes. So again, all the feedback is going to be collected. We're also going to be able to post this online, and all the input is anonymous. We aren't attaching names to it. We want it all to be considered. So as long as your comments are constructive, they'll be on the list. So let's move forward into healthy and safe communities. And the way that we're going to move through this is I'm going to read a particular section. So I will literally read that. It will just take a minute or so. I'll read through the particular goal and the supporting objectives, and then turn to you. And so for those of you that want to put questions in or comments or edits, we welcome those. We'll be able to read those. Kelly will be our resource. So to the extent there are specific questions about parts of the plan, I'm going to turn to Kelly and ask her to provide some perspective and some answers along the way. So, so with that, let's go to the first goal on healthy and safe communities. And you'll see at the top of this page, there's the byline, if you will, for healthy and safe communities. It says, provide quality and equitable housing, health, and human services for all. So that's the pillar, healthy and safe communities. The first goal of 5 says, expand integrated system of care to address gaps in services to the county's most vulnerable. So again, that's the desired future state. Expand integrated system of care to address gaps in services to the county's most vulnerable. The 4 objectives that have been identified to help satisfy that goal are the following. 1, seek legislation to eliminate barriers to data sharing between safety net departments, and they're listed there, human services, health services, Community Development Commission, probation, child support, and others. Objective 2, identify service gaps in the safety net system of services. Objective 3, create a no wrong door approach to services to encourage individuals to enter services. And then finally, objective 4, increase efforts to better integrate health action and upstream investments. So now we're looking for your input. If you have ideas to add to our list here in terms of additional objectives, if you have questions about what you see on the page, we're welcome to all that right now. So we have a question, and Kelly, you might be the right one to answer this for us. It says, what can the county do to fund mental health and residential treatment facilities for mentally ill children and adults? We know there's some scarcity of services in our community. So what can the county do to fund mental health and residential treatment facilities?
Well, I think that's part of our plan and part of our looking at some of these areas in a deeper way. We are excited that there's going to be new revenue coming into the county to support mental health services because of the ballot measure that was just able to is looking like it will pass. I'm not sure if the vote has been officially ratified yet. So that will give the opportunity to look at different ways to support mental health needs. And I think the specifics around, what that might look like, I probably couldn't answer today. But again, I think that will give the county an opportunity through this plan to, hopefully think of more ways to, support in that area.
Great. Thank you. And that might tie into some of these objectives on this page as well. Kelly, would you add anything else to this pillar? I know in the past we've had some questions about what is no wrong door, because that's, might be language that people would say that sounds like county speak for something. How would you describe no wrong door?
Yeah, well, I think no wrong door is really important and really critical for us all to think about. Traditionally in a traditional service delivery model, oftentimes services are provided in a very silo space. So you don't have a lot of collaboration between the different services. And so our goal is that you really have a no wrong door approach in how you provide those services. So if someone comes in to get financial assistance, we can also think about, well, if there's needs in behavioral health areas, how would we connect them to behavioral health services? So it's really thinking of, rather than just a linear approach to how we deliver services, more of a circular, connected approach to how we deliver services in the community.
Okay, yeah, somehow it's taking the silos down and really connecting all those services. Okay. That's great. Yeah. And I think that integration is really the heart of this goal, the integrated system. Another question about mental health in this community. Are there investments that the county can make to increase safety nets before people hit rock bottom? The comment was we tend to treat mental health in kind of a triage format. Are there other ways that the county can make investments to help people before they bottom out in their own lives?
Yes, well, and I think this, is connected to, in this plan, looking at the no wrong door approach. And also, I know that there is a specific objective in the next section that's focused on our work around upstream investments and the focus on prevention. And I think that's where, looking at this plan, how do we embed both a focus on our important safety net services and some of the programs that we might look at that are focused more on prevention, that we can intervene early in someone's life to hopefully support them earlier on.
Great, thank you. I'm going to ask you one more that came up in another group too. Upstream investments. I know that's something that you're close to, but again, it's terminology that most of our community may not be familiar with. What is upstream investments? And we note it's capitalized here too, so it stands for something specific. What is it?
Yes, so Upstream Investments is an initiative that we are very lucky to have in our county. A little over 10 years ago, our county board of supervisors had the foresight to think about how we could create an effort that would take a focus on how we could move investments towards, as it sounds, upstream into prevention, and reduce our investments in more costly downstream interventions. So how could we move people hopefully away from the criminal justice system, which tends to be really expensive, and invest in things like parenting programs, evidence-based programs that we know are really working in our community. And so we have our mantra, invest early. We want to invest in prevention. invest wisely. We want to invest in things that we know really work, and then invest together. The county is one of the largest funders in the community, but we also try to partner with our other funders in the community to think about how we can bring investments together to promote community well-being and health. So there is a board chartered initiative, and the Human Services Department, actually in my role, I manage the initiative. We get to staff that initiative.
Got it. Okay, good. Thank you. Just want to remind the people who are joining us that they can post reactions and questions in the Q&A. You can also plug in through Facebook as well. And we really welcome your inputs, and the whole transcript ultimately will get forwarded to the board for their review and consideration as well. So don't hesitate to join right in. Some of it could be questions. You could also have a reaction to something that you're seeing on the page and say that you like it, or say that you're confused about it, or maybe you don't like what you see and you have a better idea. But we're really taking all comers here, and we really want your input to help refine the plan. Somebody mentioned community-wide prevention. Said we used to have an iWalk program. Can we have that back? And then there's maybe an iBike program we could have, and promoting active transportation in general. They didn't see it on the health and safe communities pillar. And I'm wondering, is there something do you have any insight on that, either iWalk or the potential of an iBike and more active transportation, Kelly?
Well, this does link to another element that's called out in the plan with Health Action, which is a partner initiative that Upstream works with, that is looking at community health and well-being and brings together a diverse cross-sector of partners to think about community health from the lens of education, income, and health, the health system. And so some of the early work in that initiative, community partners came together to launch iWalk, iGrow, iWorkWell. Many parts of the community still have entities that work on those community collaboratives. I think this might be something we could take back to the steering committee around, if those efforts are happening, how do we connect better connections between that work within Health Action that supports Health Action chapters in each community across the county. How are we building those connections so people might be more aware of those opportunities?
Great. And for those of you that are not familiar, Health Action is a multi-agency collaboration sponsored by the county, but it's multiple agencies and nonprofits working together to enhance the health of Sonoma County. Again, want to remind you to put your questions in the Q&A, not in the chat function, but in the following the Q&A icon. That's the way to get your comments into the chat via Zoom, Q&A function. One more question here, Kelly, and then we'll move to our quick poll. What are you thinking of as a no wrong door approach? We already have coordinated entry, which is flawed, but might work for homeless services, but nothing for all county programs. And I think you've described that people could access a variety of services through no wrong door. Are you familiar with coordinated entry too?
Yes, and I mean, this is a great idea. It potentially is something that could come back to the steering committee around how do we take examples from other areas that we might be able to apply to things like homelessness. And so, at the heart of No Wrong Door in general is that idea around integrated service delivery. And so I think that's something, the steering committee could look at more.
Great. Good, thank you. So we're going to go to our first poll because we still have 4 more goals to go through. And Catherine, who's behind the scenes, will put that up. And it allows those of you who are participating on Zoom to click on the 2 objectives you think are most important for the county to accomplish first. So the 4 objectives that you've been looking at are on this poll. And you can click 2 of those objectives you believe are most important for the county to accomplish first and submit those. And Catherine will reflect back the results of our poll. So you just have about 15 seconds to do this. Okay, and here's the results of the poll. Several of you voted, and you can see number 1, seeking legislation to eliminate barriers to data sharing was the top vote getter on our poll. And again, this isn't to vote any particular objective off the island. The spirit here is to reflect back to the Board of Supervisors what the community cares about. So that was our first goal. We're now going to move to our second goal, and we're going to use the same process. So again, if you have comments or questions, put them in the Zoom Q&A, and we'll have a chance now to look through goal number 2. I will read them again and then give you a chance to jump in. So goal 2 is establish equitable and data-driven distribution of services. Objective 1, safety net departments will track results using results-based accountability for key programs in each department to establish common outcome measures. Objective 2, develop dashboard tracking tools to collect data on common outcome measures across safety net departments. And objective 3, identify and address disproportionate racial and social impacts. So those are the 3 objectives in service of goal number 2. And we'll take your comments, questions, again, using the Q&A function in Zoom or via Facebook Live. And again, too, if you're just joining us and you prefer to email, that email address is strategicplanning@sonoma-county.org. And we can collect those emails as they come in too. So if you have some thoughts that you want shared and some inputs that are appropriate for this discussion, we'll try to get those highlighted during this hour. There was a question I know in past sessions about results-based accountability. And the way I understand this, Kelly, it's really about kind of creating naming desired population outcomes for the community, and then determining which programs are going to best support those and asking for accountability at that level of program management to achieve those community outcomes. Is that how it's being used in the county, or how would you describe that?
Yeah, so that's a great way to explain it, Gary. We're working within the county right now across all our safety net departments to look at across the investments we make. So our various contracts that we work with our nonprofit partners on, to think about what are we all trying to achieve collectively. So what are those population level results that if we want to see, overall more people employed across our community, what does that look like at the program level to help us get there? And so we're looking both at that population, that bigger level, but then also drilling that down to, in a very simple way, what are a few key performance measures and metrics that we can use to describe if our investments are working or not. And then we'd be able to bring back that information and, hopefully in a future strategic planning session, actually use some of that information to plan where gaps might be in services, where we might need to address some additional needs in our community, because we would have a better idea of, what's working and or where we might need to enhance in some areas.
Got it. Yeah, it sounds a little more rigorous. The question about safety net departments came up too. The ones that were listed on the last goal includes human services, health services, the Community Development Commission, probation, child support. Are there others, Kelly, that you would include in safety net departments?
Child support service, the ones you named: child support services, probation, Community Development Commission, health, and then human services. Yes. Okay.
And again, I think what you're hearing in goal 1 and 2 is goal 1 to integrate the work of those departments more closely with data sharing and one door, et cetera. And number 2, goal 2 really is about using data to drive some of the outcomes and hold program leaders accountable for the outcomes that they're getting as well. There's a question, interesting question here about what do you plan to do to deal with the barriers to these objectives, i.e. department resistance to working with new people, fear that this will result in less funding for current staff and projects. And I think this is really good insight. I mean, I think it's something that the people who are managing these objectives will have to be mindful of as they manage change. I don't, for all of these objectives, they haven't been assigned owners yet, so there isn't a plan yet to deal with the resistance, but I want to appreciate that question because I think for any significant change, there's naturally, you know, some reluctance, some hesitation to jump into new ways of doing things. Question is, can you make the data tracking available to the public, like shelter capacity, housing options, etc.? Is that in your wheelhouse, Kelly?
Well, I think there's a couple efforts that are part of results-based accountability, this at least within the realm of the contracts that we would be reporting on. That information will be developed into an online dashboard. We've already developed that dashboard that will be able to be transparently shared across the county and linked to. I think, you know, being able to broadly share data and be more transparent about some of those numbers would be a great thing to bring back to the steering committee. I know that there's a lot of innovative work happening within our county to be, you know, more transparent around our data, such as I just explained with the dashboard. You know, we also have Access Sonoma County, but I think that would be something good to look at.
Good. Yeah. Interesting question here that came from related to the last question about what level of employees typically have access to this data to, you know, to create this response. Where does that happen? Is it with managers or program managers? Curious about that in terms of the transparency and who has access to what.
Yes, well, it just depends on the data source and how, you know, we have within human services, you know, we have child welfare data that's very heavily protected that, you know, it's a little bit difficult and beyond that program to be able to share that data outward. You know, some of our contracts that we manage, you know, we do get aggregate data from our partners that we would be able to on an aggregate level report out on. But as far as who manages those, you know, it could look different by department. For instance, in our department, the program manager, and then we have a contract management division. But most likely those are usually either, you know, the social worker who's inputting the data and or, you know, the program manager that would be, or section manager that would be overseeing those data.
Got it. And the related question that came in was asked, will these data create feedback and response from county employees? And the answer is yes, because the whole point of results-based accountability is to use that to guide choices and programs in the community. Yeah, good questions. For those of you that are interested in transparency too, one of the elements of the strategic plan has to do with the county finding more ways to be transparent, particularly with budget and some of its strategic choices. And that shows up on the organizational excellence pillar. So for those of you that are getting on the survey and want to provide some input on a different pillar, that's all available to you as well. Could you drill down with the addressing disproportionate racial and social impacts? So somebody had a particular question on objective 3. Can we drill down further on that? As I mentioned before, the objectives are broadly framed at this point because the owners haven't yet been identified. So we don't have the strategy for that, or the tactics rather, to support that. And at this point, I don't think that's even been assigned. So some of those details will be to follow. Kelly, I don't know if your department's dealing with that at all in terms of already discovering ways to address some of those disproportionate impacts.
Yeah, I know that we are definitely, again, you know, using data to look at some of the disparities that might exist and the disproportionality of some of our services and who gets referred to some of our services. And so that's definitely been a topic as we think about now with the equity officer being hired in our county and taking on a deeper look around racial equity work within our department. For instance, I know our child welfare services is really taking a leadership role in looking at some of these aspects within our work. And so I think there is a lot of opportunity here, and I too look forward to how this gets built out and what specific strategies will be implemented under this area.
Great, thanks. Yeah, and I think that's, I just want to make that point for everything the community is seeing today on this plan. It is a draft and the objectives still need more refinement, and that's why we're doing this session. They haven't been assigned, and the implementation plans and the actions haven't yet been identified to achieve these objectives. So we're still early in the game, and your input's useful. Even the questions, if it looks vague to you, that's useful input also for the steering team and for the board to do more refining. Had one comment, it sounds like you will need to meet goal 1 from the first slide, and that was about eliminating data sharing barriers in order to have safety net departments be able to use RBA across departments. So yes, to the extent that it involves community membered information, but if it's outcome measures, it can already be shared across departments. So I think there's probably 2 different levels of data there that we can be talking about. We're going to move now to our poll for goal number 2, and Catherine's going to put up the poll for us. It'll be, again, an opportunity for you to share what your sense of priority is for the objectives that are most important to you for the county to accomplish first. So check 2 boxes, submit. Again, you'll just have about 15 seconds or so to do this, and Catherine will put up the poll results for us. All right, almost everybody put objective 3 as one of their top 2, identify and address disproportionate racial and social impacts. Thank you very much for that. We're going to go to goal 3. And if you're just joining us, I'll quickly review the goal and the supporting objectives, and then we'll ask for comments. We'll ask for questions, inputs, edits. If we're missing opportunities or missing a potential objective, please send it our way. Goal 3, increase housing development in your transportation and services. Objective 1, identify 2 or 3 county-owned properties for housing options, partnering with developers and the community. And objective 2 is create innovative funding sources for housing development. So 2 objectives to support goal number 3. And a question here that I think is terrific input: if the county is going to build around transportation hubs, can we create a better, affordable public transportation system with more routes and more frequent stops? So that's really useful input. Kelly, I'm guessing transportation isn't your sweet spot, but we can take that input back because
input though, it wasn't. Yeah.
Terrific input. And I think that's the kind of input we're looking for, because if we're going to build around hubs, it makes sense to find easier ways for people to commute from those routes. We also got a thank you coming through, and thank you for that. How can the county promote building more affordable housing and make it more difficult to build market rate homes? So we know there's some things that have to do with the permitting process and the costs there. Are there other dimensions that you're aware of, Kelly, or should we just leave that as input for now?
I think we can leave that as input. I think, there are a lot of different ways that you can go about that. And I feel like that would be something for the steering committee to look at how we go about potentially looking at that.
Great, thank you. And we have other helpful input here too. How can you talk about housing without also discussing the availability of well-paying jobs to support the people we will be housing? Seems like the two go hand in hand. So thank you for that.
Insight.
And you might be interested to know the Economic Development Board just released a recovery plan that addresses jobs, it addresses wages and other dimensions about supporting the well-being of our community. If we want to increase housing, why don't we upzone everywhere in county sewer? We need missing middle housing like duplexes, triplexes, fourplexes, but need ministerial approval. So thanks for that. Is the county thinking of ways to address access to healthy food in addition to these initiatives for housing in the strategic plan? So again, this particular goal is very focused on housing development, but I don't know that food specifically is addressed in here. Kelly, have you seen it on the Healthy and Safe Communities pillar?
You know, I haven't seen food specifically called out. I do know that we have, you know, our Healthy Communities section within the public health division of the health department that definitely focuses on, you know, looking at food deserts and how do we increase access to healthy food options for communities. But I don't see it specifically called out. So that might be feedback to take back.
Great, thank you. And does Health Action have a component on food and healthy food too?
Yes.
Okay.
The Food System Alliance.
Great. Another comment coming in, I support this goal, but it's important to make sure that any development of county properties is not done in open space areas, so we aren't losing access to our green areas. Instead, focus on areas that can be repurposed, like older office buildings. And a helpful link was included with that. So thank you for that. I know this plan is focused on the actions that the county can do within its area of operations and staffing. But to be successful, the county additionally needs to identify how it will be working with other agencies, communities, and organizations to achieve broader goals for the county area. So amen to that. Thanks for that input. And I think what you'll find in many places are references to partnership with other agencies, getting grant money from state and federal funding, working with local nonprofits, et cetera. But you're absolutely right that the county can't do this alone. It needs to be done in partnership. If you want to submit your comments, please do it either via the Facebook or else on the Q&A, icon on Zoom. So that's the way that you can enter your questions or enter your comments. And again, for those of you that just joined us, strategic planning at sonoma-county.org is another way to provide your input. You can do it via email. Strategic planning at sonoma-county.org is another way to get your input in. And you can submit questions on Facebook Live if you're on Facebook Live as well. So Catherine, I think we're going to do the poll on goal 3 now. And for those of you that are playing along at home here, just pick one this time. We only have 2 supporting objectives. Check one of the boxes that you think is most important for the county to accomplish first. Again, if you're just joining, the purpose is really just to share community input and perspective with the Board of Supervisors and with the steering team that's responsible for refining this plan. So what's important to you of these 2? Is there one that's more important? Check the box. We'll give you a few seconds to finish that, and Catherine will show us how people voted. All right, pretty close, with a little edge on number 2, create innovative funding sources for housing development. So thank you for submitting your polls. And we're going to go to goal number 4. So it's goal number 4 of 5 goals. Again, I'll read them and then give you a chance either via Facebook Live, email, or your Q&A icon on Zoom to submit comments and questions. Goal 4 says reduce homelessness by enhancing services based on coordination and collaboration. Objective 1, partner with cities to build a strategic plan for homeless strategies. Objective 2, reduce current homeless population by 10% annually. Objective 3, create a housing resource tool for safety net departments to efficiently assist residents with housing. So 3 objectives designed to achieve goal number 4. And looking for your input. One's a question. Is there really no other good option for providing quality, equitable housing in the county? And I think that's a question we're all sitting with, and it's a worthy question we can forward along with the other inputs today. I think as the steering team and ultimately the board goes through this plan, they're going to need to think long and hard about what are the different strategies to reduce homelessness and really examining all the options. How can the county promote building more affordable housing and make it more difficult to build market rate homes? I want to see us reuse buildings or infill properties like Sinead. So thanks for that. We have affordable housing in Sonoma County, but not enough. How much more affordable housing do we need, and will we ever get there? And I don't know what the latest numbers are, Kelly, but I know they're daunting in terms of the shortage of affordable housing in this community. I think it's in the thousands of units, and it's a big lift. And the county, I think, is doing what it can, but if people have other ideas, let's get them on this plan. Another comment, the county can't do everything. Can you provide more funding to nonprofit partners and evaluate only work with the best nonprofit performers? So I think that's something that could be considered for this plan too, because we see partner with cities, but there might be other partnership opportunities available with nonprofit partners. And then the question of the day, is there a way the county can prevent homelessness? I'm guessing your department works on this, Kelly, and you touch a lot of the other safety net departments that are all impacted by this. What does the county think about the intersection of mental health and homelessness? Are there people who are homeless by choice / design? And from my interactions with some of these leaders, yes, the answer is yes to that, but the vast majority are not choosing that outcome. And we know there's a high intersection between mental health and homelessness. A big issue is that housing is not affordable because workers do not earn enough income. What are routes to subsidize housing for workers in the county? So thanks for that question. That maybe belongs as part of the strategies to support this goal. One suggestion, use the Sonoma Developmental Center. And I'm assuming it's the land, it's the buildings, it's the space there. Great inputs, people. Thank you very much for participating in our session. We have a couple more minutes to stand on goal number 4. If there's any other inputs or questions you'd like to add to the mix. Again, email, Facebook Live, or the Q&A icon on Zoom. So Catherine, I think we should go to the poll, and then we'll get to our last goal. So here's the poll for goal number 4. What 2 objectives are the most important for the county to accomplish first? And again, the vote is really to reflect back to the Board of Supervisors, the priorities that exist in the community. What do people care about getting done here? So what are the top 2 for you? Take a few seconds to read over the list, check 2 boxes, and submit. All right, thank you. So the top vote getter was about partnering with cities to build a plan for homeless strategies. And second, create a housing resource tool for safety net departments. Great, thank you for your inputs. So last but not least is our 5th goal. And our 5th goal focuses much more on public safety. And I'm going to read the goal, the supporting objectives, and then we'll give you an opportunity again to put your inputs in, put your questions in, and again, everything will be forwarded. Even the ones I can't get to today are going to be forwarded to our steering team that's refining the plan, and ultimately to the Board of Supervisors. It'll become part of the public record as well. Goal 5, continue to invest in public safety so that residents and visitors feel safe in our community. Objective 1, focus on cultural competency training and de-escalation training and techniques for county workforce. Goal number 2, better integrate services and handoffs within the safety net departments. Goal number 3, or objective 3, assess and determine the most appropriate community response program to respond to individuals in the community experiencing a psychiatric emergency, including an analysis whether to expand the mobile support team. Objective 4, explore and expand detention alternatives with the goal of reducing the jail population and reducing recidivism. Objective 5, conduct outreach and engagement campaign with communities to build and strengthen community and law enforcement relationships, including education on the difference between calling 211 and 911. So these all have slightly different objectives supporting the investment in public safety for our community. So again, are we missing any key objectives that ought to be on the list? Are there inputs you have to help us edit and refine this? Input here, also in the form of a question. The board controls the sheriff's budget, and we know that many calls are for mental health crises. Can the county reduce or eliminate sheriff funding and instead fund mental health response? So thanks for that. And I do believe that much of this is dedicated to supporting mental health response. How can we create a safer environment and less fear for residents who live here and are undocumented? No one should be afraid of coming to local law enforcement for help or be deported for a traffic violation. Right, thank you. Another input, I'm a big believer in the mobile support unit, but only if they are unhitched from the sheriff. They need to answer some or many 911 calls on their own. Is that the plan? So personally, I don't have the details on this. Kelly, are you in the loop at all on this?
No.
Okay. So thank you for the question and the input. Again, the objectives are going to need to be refined by the steering team and ultimately then assigned to owners before they're submitted to the board. So different departments will have responsibility for achieving various objectives that are on this plan, but many of those are still TBD, to be determined. Traffic is a determinant of safety. Does the county support Vision Zero? Work with City and Caltrans to promote this. Are you involved at all in Vision Zero?
I'm not familiar with that, no.
Okay. So thank you for that input. Kelly's in the Human Services Department and has been a great resource to us for parts of this plan. Some of this is outside of her wheelhouse. But again, keep those questions coming because those will all get submitted and they will help the steering team as it goes to refine the draft of this plan. I want to mention again too, for those of you that want more time with this or want to bring colleagues or neighbors along onto this plan, we do have the survey that's available too online. And you can look at all different dimensions, not just the health and safe communities pillar, but the other 4 pillars as well. So it's another opportunity. So thank you to the participant who wrote back and said, Vision Zero is an effort to eliminate traffic injuries and fatalities by redesigning roads and transportation systems throughout the county. Great. So we had a question, and I don't know if I have the answer to this. Are there statistics? So this relates to the last goal about homelessness. Do you know, Kelly, if there's a place where people can go to get statistics on to show how many formerly homeless people successfully transitioned to being housed? Is there a public database that you're aware of?
I'm not totally sure about a public database. I know that the Community Development Commission collects that data for some of the programs that they serve through their HMIS system. But that would be a good question because I'm not sure if there's census data on that specific point.
Okay, so we mentioned the Community Development Commission before. You can also call them, contact them, and with that question as well. We don't have that answer here. The Community Development Commission is one of the safety net departments we referred to earlier in this hour, and they were named a few times relative to some of the particular healthy and safe community goals.
And I think the county does report out on that data, so it might, but again, I don't know off the top of my head. That's not my data expertise area.
Maybe we can ask Siri.
Yeah.
We'll take one more minute to see if there's other inputs that we can get up here before we close today. Again, we have received several comments along the way, and I just want to acknowledge that. We've received a lot via Facebook, particularly just, shouting out that we want to prioritize solving homelessness. So a lot of comments in support of solving homelessness in Sonoma County. So I want to acknowledge that's an important aspect of our community that many, many people want addressed. All right, let's go to our last poll, Catherine. We're starting to get close to the top of the hour again. We'll let everybody pick what's most important to them from these 5 objectives. So as we've done before, Catherine's showing you 5 different objectives that are supporting goal number 5. Pick the 2 that you think are most important for the county to accomplish first. So again, this is based on your sense of prioritization for the public safety goal. Catherine will show us the outcome of that, and then we'll move to close. Great, thank you very much. So here are the results of that quick poll. And objective 3, assess and determine the most appropriate community response program to respond to individuals in the community experiencing psychiatric emergency. So that was the top vote getter for a quick poll, and I want to thank you for participating in that. And just in closing, you've all been very helpful today. The questions you've asked are very illuminating. The comments and insights you've offered are extremely helpful. And as the steering team reviews this and the board finalizes its work planning for the future, they'll have the advantage of community perspective and community engagement to help guide them. Want to let you know too, the door is still open for your comments. We have an online survey, and the address there is on the page, SurveyMonkey. And then also, if you decide you want to email with additional thoughts, strategicplanning@sonoma-county.org. On behalf of the County of Sonoma, I want to thank you all for your participation today. Stay safe. Thank you very much. Goodbye.